Lisa Handa, and I'm a dental hygienist. Also, I'm a dental hygienist in alternative practice, which allows me to have an independent dental hygiene practice. And the setting that I'm currently working on for this particular project is in San Francisco, Native American Heath Center, and we are focusing our work with Head Start programs and early Head Start programs, so children 0 to 5 years old.
My name is Karina Alcala, and I work at the Native American Heath Center. I'm the pediatric project manager there. And as Lisa said, we work with children, early Head Start and Head Start.
Because of its innovation, I like working out in the community setting, the interactions with people. Prior to this project, the interest in working outside of a traditional office was always appealing to me, and helping communities who have difficulty accessing care. So I see this project as being a really innovative way of helping those individuals.
So their first visit to the dentist will be just when they have a more serious dental problem, because these children that we saw at Head Start, they were like between 3 and 5 years old, and for many of them it was the first visit to the dentist and the first time that they had their mouths checked. So it will be like even prolonging that time for the first time visit.
Difficult day. I think one of the greatest things about bringing success to a VDH program is the importance of being flexible. And not having a high expectation of how the day is going to run, because every site is different, and you can still go back to that same site and that particular day will be different. So rolling out, picking up the equipment and traveling there and being assigned a room, maybe that we've never seen before, or a room that is very, very small, that will not accommodate all of our equipment, and so, you know, having to be creative and finding solutions for seating and things of that nature.
Your day starts the day before, at least, right? Because you need to know how many patients you're going to have, be prepared, have the instruments ready, probably review the charts, do your notes, your pre-notes, what is it, all, any other information that you might need to be ready and to provide the services at school.
The greatest success has been getting the care to the children and letting them have a positive first experience so that they're not afraid, and developing their little relationships, even though we may not have seen them that many times, but that they remember who you are from the previous. I remember that chair, and I remember the different things you had, and that's always really nice. When you're in a traditional setting, you're governed by the schedule. You know, you see a patient at a certain time, they need to be done by a certain time. When you're in a non-traditional setting, the goal is to create really the positive experience for me. So, for example, there was a child we saw at one of the sites who was very apprehensive about sitting in the chair, sat in the chair, and I think he got up and he walked away. He just didn't want to do anymore, and he went into the corner and cowered in the corner. And the normal reaction of people would be, oh, it's okay, come on, you'll be fine, it'll be fine. Instead of, what the child really needed, there were too many people trying to coax him out of the corner. Just leave him alone, give him a few minutes, and then I'm going to talk to him just a little bit. But it all took time. I think just that whole process of getting him out of the corner and back into the chair so that we could at least take some pictures and let him end on a successful note took about 30 minutes. And you don't always have that luxury of time to utilize that creativity to get a positive outcome.